Assalamualaikum students. So these are the 4 steps that we need to keep in mind while doing the physical examination of the patient, and these are very common. The first is called as inspection. We need to look for any deformities in which we need to assess the normal anatomical alignment of particular area. It is indicative of any kind of fracture or dislocation. Then we need to look for color changes, and when we talk about color changes, it can be pale, it can be red, it can be blue. That is most commonly indicating towards the blood supply of that area. And then we also need to look for any abnormal patterns of movement. The second step is palpation. We need to feel for tenderness. When we talk about tenderness, it means that when we apply pressure to a certain area, and if the patient complains of increased pain intensity, that is called as tenderness. We need to look for swelling, redness or heat from that area. We need to then look for masses or organ enlargements. Then there comes the third step, that is percussion. Percussion basically is a step in which we tap a particular area to look for the sounds in that area. Mostly that is a characteristics of some organs. They have resonance or dullness. We will not get into the detail because it's a short video. So when we are tapping to that area, we are looking for the resonance or hyper resonance, or we are looking for the dullness or consolidation into that area. Then there comes the next step, that is called auscultation. And auscultation is, we all know, listening towards the abnormal heart sound if there any. Then we need to also look for the lung sounds or even of the bowel sound. So this is all about the approaches of physical examination. One thing you need to keep in mind, while as a physical therapist, we most commonly do inspection and palpations, particularly if we are dealing a patient with musculoskeletal condition. But if we are dealing with the patient who have asthma, or if we are dealing with patient in cardiopulmonary wards or into the ICU, so we also need to go through all the steps in order to check the patient condition. Thank you so much.